Okay, I think we are rolling.
Action.
Action. Okay, great. Good to see you.
Good to see you, Doc.
Today we are going to recap based on our last visit. We said you had a cataract in your right eye.
Right.
Sound right? And today you're here for the pre-op appointment where we take measurements of the eye in preparation of the cataract surgery. So let's take a look again at your eye so we know what we're talking about. I'm going to bring this forward.
You got a yardstick here?
Yeah, exactly. We're going to measure it. Rest your chin right there is great. Okay. So people always ask, how do I know when it's time to have cataract surgery? And they'll see, right here, I'm going to show you guys what I see in the microscope, okay? All right. So, right there. Okay. So, this is the right eye. Recording with my camera there. And if you see the inside the pupil, it looks like reddish brown almost. I'm going to zoom in here. People always ask me, what camera am I using to record? I'm like, it's just my phone. All right, so this cataract, that cloudy reddish brownish lens, and let's compare it to your good eye, your left. So I'm just going to move it this way. And that has like a nice blue tint to it, like a blue filter. It looks actually really clear. And I'm going to go back to your right side. And so I usually, for patients, I explain it on a scale of 0 to 10, how bad is this cataract? And for me, I would say this cataract on your right side is maybe an 8 out of 10. Okay, so on a scale of 0 to 10, an 8 out of 10. And this one, almost nothing. Maybe a 1 out of 10, almost nothing. But that's all basically it is.
Yeah.
All right, so I got that.
So there's a slight one on the left eye.
Yeah, but it's very, very minimal. It's nothing that we are worried about at this point. Your vision's still excellent. So the time to have cataract surgery depends on two things. One, is a cataract part of the problem that's causing your blurry vision or your poor vision? And are you noticing it? So if someone has a cataract that's 5 out of 10, but their vision is good, just leave it alone. They're not complaining, they're happy. If it's 5 out of 10, but they're having glare when driving, they're not confident driving at night or reading street signs, maybe they can't read their phone properly, that's a sign to remove it because it's affecting their daily activities. And in your case, your right eye is very poor. Your left eye is good. All right. So your left eye, I recommend leaving it alone. Your right eye definitely is consistent with symptoms of cataract, and so we're going to take care of that for you.
Great.
When we do cataract surgery, we are taking out the cloudy lens and replacing it with a clear lens implant. The surgery takes about 10 minutes.
It's amazing.
In 99.5% of patients, so 99.5% of my patients, when we do surgery, we don't experience any complications. We don't experience anything unexpected. Mm-hmm. Surgery goes smoothly. But all surgeries have risk. All surgeries you can lose vision, but it's very rare. Most of the complications, if they were to happen, most of them are treatable. All right, so to lose vision from cataract surgery, although it can happen, is very rare. The whole purpose of the surgery is to make your vision better. I mean, if that wasn't the purpose, we wouldn't be doing this, okay?
Right. Yeah.
Cataracts never come back. The surgery should be painless. We numb your eye completely so you don't feel any pain. You will not be completely asleep though. We give you medicine though to be relaxed, okay? It's like a twilight,
Right.
So you're about dozing off. Some people doze off, but we don't put you to sleep. We just relax you, okay?
That's a good thing.
All right, good. So now we're gonna load up your measurements. So we take measurements to know for your eye specifically what lens implant strength you need, what type of lens implant will work best. And we always measure both eyes to look for symmetry. We want to make sure that the reading on each eye looks like it's from the same person, and that gives us more confidence. If there's huge asymmetry, then we would want to triple check that to make sure that it's truly different, like asymmetrical, your measurements. And so in your case, I see wonderful readings. They're very symmetrical in terms of your eye anatomy, and there are no flags raised by the device, by the biometer in which we measured you. You do have some astigmatism.
Yeah.
Okay? So astigmatism is something that can distort or blur your vision if it's not corrected. It's correctable though with glasses. It's also correctable with lens implants.
Right.
In an ideal world, when we do your cataract surgery, we would reduce your astigmatism.
Right.
That's an ideal world.
But now, astigmatism is the outside lens, right? The cornea.
So there's total astigmatism in your eye, and then there's astigmatism caused by certain parts of your eye. Okay. So for example, when someone has astigmatism, classically we're talking about their prescription, their glasses prescription. Right. So there might be a number on your prescription, it's called cylinder, where you might see a number. It might be 1 point, 2 points, 3 points. That's how much astigmatism your eye has in total. Right. But because we're going to be removing your natural lens, your cloudy lens, any astigmatism caused by your natural lens will be removed just by removing your cataract. Okay. So what we care about in cataract surgery is how much astigmatism do we expect to be left over after surgery. Right. And that's in your cornea. Right. All right. So you have about 1.7 points of astigmatism, 1.7 diopters of astigmatism in your right eye, in your cornea. Right. So we expect there to be that left over if we didn't use a lens implant or a laser to reduce that astigmatism. Now that astigmatism is also, like I said, correctable with glasses. Right. And so that's something to note. Now your total prescription, you have about 3 points of astigmatism with your prescription glasses, which tells me that your cataract is causing some of your astigmatism. Right. And so when we remove your cataract, most likely some of that astigmatism is going to go away just by itself. Okay. But you'll be left with the 1.7. 1.7 or so. Okay. So when we choose a lens implant, we want to know, there isn't a perfect lens implant. If there was a perfect lens implant, I would just say, we're going to give you the perfect lens implant. There's no questions about it, and that's it. But there are advantages and disadvantages of certain lens implants. And so I wanted to ask you, though, in your personal opinion, are you okay if you needed glasses after surgery, or do you want to minimize the need for glasses after surgery?
And by glasses, you mean for near?
Well,
or it can be
both.
Yeah.
Like the one way to do it, let's say you got a basic lens implant. We call it basic monofocal lens implant. Right. With your astigmatism, I would expect you to need glasses to see clearly far away, and glasses to see computer, and glasses to read up close. Okay. With your astigmatism, to see it clearly, I would expect you to need glasses. Now, let's say we got rid of your astigmatism. Right. If we got rid of your astigmatism, we can choose far vision or near. Right. Most people choose far because when you're active and you're out and about, you're driving, maybe you're at the beach, you want to see far away. Right. Whereas if you're going to sit and read a novel, it's not a huge deal for most people to put on some readers. Over the counter, they're inexpensive, unlike glasses for far, which are expensive. Right. Okay. And so if we fix astigmatism, let's say we chose you to have clear vision far away, you would use readers. Mm-hmm. The other option is to also reduce that astigmatism and in addition fix the reading vision. So for example, if we gave you a multifocal lens implant that also reduces your astigmatism, you should be able to see well far away, computer, and up close, like your phone without glasses. All three. Yeah. Mm-hmm. So they have 3 sweet spots in the lens. It's not like an infinite lens. No lens can let you see infinitely, but the lens will give you good vision far away, intermediate, and up close. Now, the more range of vision we give you, the more sacrifice in the quality of vision there is. Right. For example, if we corrected your vision far away, intermediate, and near, your peak vision would be an A-. Okay. For far, A-, intermediate, A-, and near vision, A-. Right. Even with glasses, A- is the peak. Now, it might feel like A+ to you, but knowing the other technology that's out there, it's not better than an A minus.
Right.
Okay?
Like if you just did a mono, you could bring it to an A.
Yeah, exactly.
Yeah.
So let's say we fixed your astigmatism for far and
Right.
didn't give you the near. It would be like an A plus
Right.
for far. And that factors in, like what's the difference between A plus and A minus? Contrast,
Right.
like the grays from the blacks and the whites. And also night vision.
Right.
In my opinion, based on your measurements, if you wanted A plus vision,
Mm-hmm.
day and night, you should get the light adjustable lens,
Right.
and we should dial it for far.
Okay.
We can correct all that astigmatism. You'll have excellent A plus vision, far away, day and night. With the light adjustable lens, you'll have pretty good computer distance vision.
Oh,
Okay.
really? You would
Yeah.
still have like
yeah.
a mid-range.
Yeah, so
Hmm.
there are lens implants when we correct astigmatism where it's really doesn't include mid-range, but I found from my experience the light adjustable lens gives you pretty good mid-range vision.
Right.
So like a dashboard,
Yeah.
looking at the prices of grocery items.
Right. Right. Like kind of arm's distance.
Yes,
maybe.
arm's distance is
Yeah.
really good. And there's a light adjustable, the light adjustable lens I think has that advantage in that it gives you great far and intermediate range vision for most people. Now, if you would not be unhappy with readers, okay, that's the most important question.
Right.
If you would not be unhappy wearing readers for small print that's up close,
Right.
I think you should get the light adjustable lens
Right.
as first option.
Right.
If you think you would be unhappy wearing readers, then I would tell you consider doing a lens implant that gives you
Multifocal. Okay.
multiple areas of focus.
Right.
Like for example, a Panoptix lens gives you far, intermediate, and near.
Right.
It's not as good night vision. It's not as good far vision. Like the peak would be A minus, like I was saying earlier. But you would certainly have better reading vision, I
Right.
think, than a light adjustable lens by itself.
Right.
All right? And so that's something to consider. If you're on the fence, go with light adjustable, because if you're unhappy with your vision for up close, I can easily give you a pair of readers and you would be happy with your reading, with
Right.
the readers. If you don't like the quality, the A minus quality vision, maybe it looks a little waxy to you, or maybe the contrast is low, there's not a magical fix. We would have to change the lens.
Right.
Okay? So, but if you would be unhappy with readers and you really don't want to use readers for up close small print, then you should consider
Right.
a multifocal lens. Now, the multifocal lens, the biggest complaint I ever get with them are about halos at night.
I read about that. Yeah.
Car headlights at night,
Right.
you may see halos or rings around them.
Mm-hmm.
Although over time, your brain adapts
Oh, okay.
and they may be less noticeable to you. It's
Right.
not that they go away, they're still there, but you may adapt well to it.
Yeah.
Okay? So that's something, you don't have to decide today, but that's something that I would have you consider.
Right.
Would you rather have A plus quality vision, far away, day and night, and still need readers? Or would you rather sacrifice the quality of vision a little bit, but be able to read without glasses?
Yeah.
Okay? That's something that I want you to really think about,
Right.
because the lens you choose is forever. All right? This lens implant, it lasts forever.
Right.
So you shouldn't need to change it.
That was one of my
All right.
questions
Yeah.
too. Yeah.
We only change lens implants if there's a problem.
Right.
Like maybe in the first couple months, no matter what, you're not happy with the vision.
Right.
But it's very rare, because when people really think about it, and they know the pros and cons of each lens, that then they end up choosing the lens that's right for them.
Right.
But worst case scenario, it is possible to change a lens implant. Okay.
And the light adjustable is a series of coming back in a couple times, 3 times.
There are more
getting
visits.
Yeah.
Yeah, there are more visits. So the light adjustable lens,
But it sounds worth it.
you're gonna have it once.
Yeah.
It's like going to the gym. Imagine you went to the gym 3 times, and for life you're gonna have a 6-pack. For life you're gonna have big biceps. I mean, everyone would go to the gym 3 extra times or 5 extra times, if
Yeah.
that they can guarantee that. Now, there are other options. So I gave you 2 fork. If there's a fork in the road, I gave you the 2 sides.
Right.
But there are other options. For
Right.
example, let's say the light adjustable lens was too expensive, or you couldn't make those post-operative visits.
Right.
You had a very busy schedule, you were unable to do it. Then we have lenses called toric lenses.
Right.
They're non-adjustable, but they also reduce the astigmatism.
Right.
Okay? So there are other options. Now, cost aside, I'm trying to feel you out, and I'm going to rank the lenses in order of my preference.
Okay.
Based on assuming cost aside.
Right.
But reality with insurance, there's out-of-pocket costs.
Right.
But it's something that as long as you know what you're getting, I'm happy with. You don't even have to tell me what lenses you're getting.
Right.
I'll rank them for you, and then you just tell the scheduler what you want.
Right.
Okay? Now, if you had to say though, at this point, and you can change your mind, but at this point, would you rather have the highest quality vision day and night, far vision, and computer, but still need reading glasses? Or would you rather
Say no more. That one.
That one.
Yeah.
Okay, so we're gonna go max quality.
The multifocal to me, having the A minus and the potential for A minus in all three, or maybe even a B, I would rather have the A plus.
Yeah, got it.
Yeah.
And of course, everyone prefers not to use glasses if they don't have to. So
Right.
to me, that's not the right question. The right question is, would you be unhappy with readers
Right.
if you could have A plus vision?
Right.
Right? Okay.
Yeah.
So,
and in my case, I can still see pretty well with my left eye for near or mid. So I can actually read pretty well up near. So I can use my left eye. I've been doing it
for now, yeah.
For now, yeah.
But in the future years, if your cataract progresses, we'll have the same conversation
Right.
again, but there might be different lenses at the time.
Right.
Okay? All right. So I'm going to show you guys something. I have a form here, okay? And I'm going to show it to you guys once I fill it out. But I'm basically going to rank what I think he should have to get maximum quality vision. And my first choice is going to be light adjustable lens. So I'm going to try to position that. It's actually following my face, so I can't, the camera's following me. So anyway, I'm going to put first place for the light adjustable lens. Now, second choice, I would say, is going to be for astigmatism correction, but non-adjustable. It's certainly less visits post-operatively.
Right.
It's not as precise, but it's also cheaper, so it's something to consider. That's option 2.
So there's no real mid-range, it's more distance.
It's more distance. So I'm going to show you what I think the difference is between like a light adjustable versus a toric.
Okay.
With a toric lens, I think there's about an 80% chance that you're going to see around here or better.
Right.
With a light adjustable lens, you're about an 80% chance to see here or better.
Okay.
See that difference?
Yeah.
And
so like a 20/20 bottom line?
Yeah, exactly. Okay? Yeah. And then the other thing with the light adjustable is you typically have better computer vision. There's a lens implant called Vivity, which can correct your astigmatism and your mid-range. All right? But you'll still need readers for up close.
Right.
Okay? And I think the quality of a toric lens, like a basic toric lens, is higher quality.
Right.
So in the order, if I wanted to go from maximum quality or maximum range, toric would be a little higher quality, but you would need readers most likely for even the computer. Right. Like a toric will give you higher quality vision than a Vivity, but Vivity will give you more range. Okay, so first choice is going to be light adjustable lens. Second choice is toric. It reduces astigmatism.
Right.
Third choice is Vivity.
Right.
All right. And the fourth choice is what we call the basic.
Right.
All right. So I'm ranking them in order of preference for your vision.
Right.
All right. And they're not even in order of price. Like you'll find out second choice is actually cheaper than third choice. So to keep it simple now, all you have to worry about is assuming your opinion doesn't change. First place is what I recommend for you.
Right.
If it's with your insurance and out of pocket, it's feasible, do that. If not, go down the list. Second choice.
Right.
And third and fourth. Okay?
Right. Yeah. Question about the fourth.
Yeah.
That's a monofocal.
Yeah.
What is when it's a monofocal like that? Is it a minus, A plus?
With glasses?
With the astigmatism that I have.
If you wore glasses on top of the monofocal for far, it's A plus.
Okay.
But when you take it off, maybe a B.
Okay, because of the astigmatism.
Yeah, because of the astigmatism.
Yeah.
Now, you could get a second surgery later to get rid of the astigmatism.
Mm-hmm.
But if you're going to do it, you might as well do it now at the same time as your
Right.
cataract surgery, because it's less surgery.
Right.
You know, you have one surgery anyway. You might as well, if you want to have good far vision, you might as well get rid of the astigmatism now.
Right.
Okay?
And is that a laser procedure on the cornea, or?
Yeah, if you had, there are two options, but with your astigmatism, let's say you got a basic monofocal, and 3 months later you decided you want to correct the astigmatism and not need glasses.
Right.
There are two options. Laser would be my first option, because we don't have to go into your eye anymore.
Right.
As a surgery, as long as you're a candidate for it, your cornea is healthy and everything.
Right.
But the second choice is to do a lens exchange, where we go back in surgery, we take out your first lens, replace it with a new lens.
Oh.
But, like for example, your cost can double or triple sometimes.
Right.
Because right now your insurance is covering your anesthesia,
Right.
covering the surgery center, they're covering most of the costs associated with cataract removal.
Right.
If later you want to change your lens implant just for the heck of it,
Right.
because you change your mind, the insurance will say you're on your own. Like, you don't have a cataract anymore.
Right. Right.
So you're paying for your anesthesia, you're paying for your facility fees and all that.
Yeah,
things.
yeah.
Okay.
So I got a general question about just the surgery. So
Yeah.
it's to remove. It's a surgery, but not a laser surgery, or is it a combination of both?
Great question.
Yeah.
And this is controversial. When someone removes a cataract, there's two ways to remove it. We can remove it all by hand,
Mm-hmm.
or we can use laser to assist in certain steps of the procedure.
Okay.
In my opinion, the goal of laser is to either help you remove the cataract in an easier way, or to improve safety, or to improve your vision.
Right.
Okay? Now, let's say you get the first option, light adjustable lens.
Mm-hmm.
The laser will not, in my opinion, make your vision better with a light adjustable lens than the light adjustable lens alone, done manually.
Right.
Because the light adjustable lens is so precise, the laser is not going to do anything
Right.
for your vision.
Right.
Now, if someone has a weak cornea, maybe a very dense cataract, the laser can be helpful, but it's not necessarily to improve your vision.
Right.
Let's say you got a basic lens implant that doesn't fix astigmatism.
Right.
Well, the laser can reduce astigmatism. So now there's a benefit to laser.
Right.
But if you're getting light adjustable lens, the question becomes, well, is it a waste of money? What's the bang for my buck?
Right.
Now, if you're a billionaire and you're like, hey, give me anything and everything that may help, you can do it. But most people I see are not Elon Musk or Bill Gates, so they are factoring the price. So I think the lens implant is more important. So first decide on the lens implant.
Right.
And then we can decide if the laser is going to add value.
Right.
Okay?
Okay.
If you're going to go get something more basic, then the laser can lower astigmatism, but not as good as the lens implants.
Right.
Both the toric and the light adjustable will lower your astigmatism in a better, more predictable way, I think, than the laser.
And does the inner lens attach to the muscles on the inside, the ciliary muscles? Do they reattach it there, or is it kind of just snug there? Is it?
There's a muscle, the muscle you referred to, the ciliary body.
Yeah.
It has these little fibers we call sinules attached to your current cataract. The cataract has a capsule that these fibers or sinules are attached to. We're going to keep that in there.
Okay.
We're going to take out the inside, the cataract from it, retain the capsule that's holding your cataract that the muscle's attached to.
Mm-hmm.
But the lens implant's not flexible. So even though your muscle may work, it's not going to change the shape of your lens implant or the way the lens works.
Yeah.
Exactly.
Okay.
Now, in the future, in years from now, new technology may come out that might try to mimic that.
Okay.
It has come out in the past, but it didn't work as predicted.
Right.
But we're always hoping for new technology that can work with your eye muscles.
All right. Yeah, I was curious about that. I didn't know how it worked once you put it in.
Yeah, eventually I hope we have something that can be very predictable and work consistently, but it's not out at this point.
Right.
Yeah. So your cataract surgery, you'll arrive about an hour prior to your surgery schedule, and they're gonna, you'll check in. They'll give you some drops in your eye in preparation, and then we'll numb your eye, give you some sedation. The surgery itself takes about 10 minutes. Like I said, you go to the recovery room where they'll give you some maybe juice or something, because you would have been fasting that morning. And then you go home. Okay. So total at the center, you'll be there for about 2 hours or so. You should have someone with you to go home with you, because you might be a little groggy from the medication. Okay. But most people the next day, you can drive yourself. Right. If you get a light adjustable lens, we're going to give you some UV protective glasses. There's UV, you're going to get 3 of them. Right. They all protect from the UV light. Right. One is dark, one is clear. And the other one's clear, but it has a bifocal for reading. In case you want to read. But they all can be worn out in the sun, so you don't have to limit your activity outside. You can still go golf and things like that, but just make sure you're wearing your UV protection.
For a while.
Yeah, on average about 6 to 8 weeks max. Okay. Yeah, because we get your adjustments.
Is that after the adjustments you start wearing those, or right after the surgery?
Right after the surgery. Okay. Once you're adjused and locked in, you can take them off. Okay. So we start the adjustments a few weeks after surgery. You might get 1 or 2 a week. Right. For a few weeks, and then you're done. Okay. All right. We'll give you some more information. You're going to meet with Candy. Okay.
Do the scheduling.
Right now for the scheduling. All right.
Great. Thank you.
Pleasure, sir. Take good care of you. You got it. Yeah. All right. Thank you for sharing.
And as far as the insurance.
Yeah, we're going to get approval.
Would Candy do that? Like sit down and show what?
Yes.
Okay.
So here's something that a lot of people get wrong. Health insurance covers cataract surgery as long as the cataract is visually significant. Right. You don't need your vision plan. You don't need VSP. You don't need IMED. You don't need a vision plan. That's health insurance. Yeah. So all health insurance, as long as the cataract is significant, they cover its removal. And so we're going to get max coverage from your insurance. As much as possible that they can cover, we're going to get them to cover. And whatever...
8 out of 10 is significant.
Yeah, exactly, yeah. So whatever they don't cover, that's, you cover the difference depending on what technology we use for your eye. It's kind of like, I tell people, if you ever have like car insurance and auto insurance, and you get in a car accident, and the insurance company, while they're repairing your car, says you can spend $50 a day on a rental until they fix your car. Well, you get to the rental place and they say, well, you can pick from these cars, but there's a Ferrari in the back. And that Ferrari is $500 a day or $1,000 a day. You can use your insurance for the $50 a day, and then you can pay the difference. Right. So, and they have many options. They have a Corvette for $200. So some people will say, well, I was driving a Corvette when I got an accident, and so I want to rent a Corvette. It's up to them, Yeah. It's personal preference. It's not for me to tell you, this is not worth it for you. It's too much money for you. It's like, what do I know? I only know the vision that a lens implant can give you. I can't say if it's $1 or $5 or $5,000, whether it's worth it or not. Yeah. Only if I think like you wouldn't be able to tell the difference between 2 lenses, then I would tell you, you might not notice a difference, so save your money. But if it can improve your vision even 10%, how do we value that? Right. Is 10% better vision worth $50, or is it worth $5,000? Is it worth $50,000? Right. I cannot be the judge for the patient. Right. It's a personal decision, just like when you buy anything. Right. So my approach is these technologies can give you the vision you want. Right. Cost aside, this is how I will rank them. Right. And then based on that, you're informed. You decide which one you want. Whichever one you choose, I will do the best possible job installing it for you, so it can work at its peak potential. If there's any issues along the way, which there can be with surgery, then we'll address those issues. All right. Okay?
Great.
All right, sir. My pleasure. All right. Thank you so much.